All right, so today we're going to be talking about informed consent. You might be thinking about the legal obligation that businesses or healthcare providers have to make sure that their customers or patients, that they're aware of what they're getting themselves into, that they've signed a piece of paper saying that it's okay. And while it's true that patients have a legal right to know what they're getting into, we also think that they have an ethical right to know and understand what they're agreeing to. So informed consent in the ethical sense is a much more in-depth process than legal consent. It's a right supported by the principles of respect for autonomy, and beneficence. And it's designed to create an obligation on the part of the provider to ensure that the patient's autonomy and interests are always protected and that they know and understand what they've consented to and the consequences of that decision. It's a rigorous process that has 4 elements or criteria that have to be met in order for a patient to give informed consent. So let's look at those 4 elements now. The first one is information. So this ensures that the patient has all the necessary information in order to make the decision that works best for them. So it doesn't mean that they have to have an in-depth, perfect knowledge of the chemical composition of a drug or the complete history of the development of surgical technique. It means that they need to have all the relevant information to their specific case. So we're looking for relevance. So knowing the prognosis, the risks, the benefits, and possible alternatives is important. And providers have an obligation to make sure that the patient has all of this information and whatever else might be relevant to the patient's decision-making process. So while we tend to think that risks, benefits, and alternatives are kind of the 3 categories that we definitely need to give, there's other information that's also relevant to the patient's decision-making process, such as maybe religious implications, how frequently this is done, maybe some of the lifestyle changes that have to happen afterwards. So can they still eat spicy food? Will they have to be on medication for the rest of their life? All of this information is important, and so whatever we find relevant to the patient, so whatever needs to be addressed in terms of their values, their goals, their interests, or beliefs, and then whatever they need to know medically, all of this information has to be given. The second element is voluntariness. So healthcare providers need to make sure that patients are free to make their decisions without undue influence. Now, this doesn't mean completely free of influence. That would be nearly impossible simply by the nature of human interaction. And it could also be potentially harmful to the patient, since it would require the provider to withhold their professional opinion, which, is obviously a lot more experienced and skilled than, say, the patient, where all this information is new to them. Your opinion could actually be really helpful and important in their decision-making process. So we're not looking for no influence at all. We're simply saying no undue influence. So the patient should not be inappropriately influenced. And while context always needs to be considered, it's generally acceptable to try and rationally persuade your patients, but it's never okay to coerce or threaten patients, or allow a patient who has been coerced by a family member or a business partner or a friend to consent to something. So if we look at this as kind of a spectrum, right over here we have rational persuasion. Which we generally all think is pretty good or acceptable. And on the other side over here, we have coercion. So this is going to be threat or fear of threat or retaliation, fear of physical harm, that kind of thing. We always tend to believe that this is pretty bad. It's never okay to coerce your patient, and more than that, it's not informed consent if the patient has been coerced by somebody else when they make the decision. And in terms of manipulation, which kind of falls in the middle, it's a little bit of a gray area. We decide whether manipulation is appropriate or inappropriate depending on the type of the manipulation and the context of the situation. So again, we're just going to say that this is a little bit of a gray area. You're always okay when you stay over here, never okay over here, somewhere in the middle. Well, it kind of depends. So is it manipulation by omission? Are you leaving important information out? We're going to say that that's pretty bad. But if you're trying to make them understand, say that like this is going to have an impact on their family, playing into that kind of emotional connection, we might say that that's somewhere like over here. The third element is capacity. This is tricky because a healthcare professional has to establish how capable a patient is of making the decision at hand. So we're looking to measure 4 things. The first is the patient's ability to intellectually understand what's being asked. So is the patient capable intellectually of understanding the information, the choice at hand? Do they have all that understanding? So again, if we have somebody with severe brain damage or cognitive impairments, we might say that they might not have the intellectual understanding, in which case they wouldn't have capacity. There's also other ways in which intellectual understanding can be affected. So Alzheimer's, certain mental illnesses, or children also might not intellectually be able to understand certain things. So we would always be testing for that in capacity. The second element that we're looking for in terms of capacity is appreciation. So whether or not the patient appreciates the consequences of the situation, that they can forecast these consequences as happening, whether or not they truly understand how serious this situation is. So if we have somebody in the hospital whose leg needs to be amputated, and we tell them, hey, we're going to have to amputate your leg, and then they say, cool, that's fine, can we do the procedure today because I have a surfing competition that I need to get to on Wednesday, we might say that they don't necessarily appreciate the consequences of what this is going to do, because the likelihood is that a few days after an amputation, you will not be doing a surfing competition. So whether or not they take seriously how altering this procedure could be, whether or not they're capable of forecasting the consequences, so whether or not they can see that the chain of events and how that's going to lead to certain consequences, or whether or not they truly seem to appreciate the seriousness of the situation. The third element that we're looking for in terms of informed consent is going to be consistency and rationality. So we're looking to see if they have a consistent value, a set of values, or a consistent understanding of what's good. If they seem to be lacking this, if it changes from minute to minute, we might say that there's a problem with consistency and therefore capacity, because when we do a procedure, especially one that has long-lasting effects, we want to make sure that they can live with these consequences or accept these consequences day in and day out with general consistency. So if somebody says, yes, I want a transplant, and they're like, yes, of course, I'll take the immunosuppressants, afterwards, and then, a few minutes later, they're like, oh, I would never take immunosuppressant drugs. There seems to be some lack of consistency there, and by extension, some problems with capacity. So, patients with Alzheimer's might be, or dementia might be, something that we have to take into consideration when we're looking at consistency. In the same vein, reasoning. So if there doesn't seem to be consistent reasoning, or if they continue to run into contradictions in their rationality, we might say that there's a problem with capacity. The fourth element is going to be expressing a choice. So can the patient clearly express the choice that they want to make? This can be a problem when we're coming into language barriers. So if the doctor speaks English and the patient speaks Russian, there doesn't seem to be any general overlap. Not only does the patient not have the information necessary to make the decision, but she's incapable of making or expressing the choice to the doctor, who wouldn't be able to understand her. And so we wouldn't say that in this particular case that the patient has capacity. That has less to do with her cognitive understanding and more to do with situational barriers, which can obviously be addressed with a translator or something to that extent. But until that gets resolved, we can't say that she's giving informed consent. So someone in a vegetative state would also be somebody that we would say doesn't have capacity, simply because they wouldn't be able to express that choice. The final element of informed consent overall is choice. So has the patient made a choice? Yes, no, maybe? At the end of the day, the patient has to actually make a choice. Without doing so, no consent can be given. So until the patient actually expresses yes, no, maybe, or tells you exactly what they want to do, they haven't given any informed consent. So silence on the part of the patient does not mean yes, and it does not mean no, and it doesn't mean maybe either. It means nothing. So a patient has to express this choice. The healthcare provider has an obligation to make sure that this choice has been clearly expressed and that this decision has been made before we can move on to any sort of decision making in terms of when we're going to do a procedure, how we're going to do a procedure. Until the patient makes this choice, there is no informed consent. Later on, we're going to talk about what happens when a patient cannot give informed consent, or we've determined that informed consent is not a possibility. And we'll talk about what the procedure is and what happens, and some of the ethical implications of a patient who doesn't have the ability to give informed consent.